Planning. Okay.
All right, welcome everyone. Thanks for joining. Today is Wisconsin Coalition for Social Connection Network meeting, our August edition. Before we get started, we are going to start with what we previously called icebreakers, but our new coalition coordinator, Vicki, has this new reframing for us, and we're going to call it connection before content. So if everyone would like to drop your name and then what is something that you do every day to connect in the chat. And we will start with that before we get into our very busy meeting for the day. And I'll just ask while we do this, if everyone could please mute until we are ready for some feedback, that would be great. So if you don't know me, my name is Suzanne Morley. I'm a health promotion program coordinator with the Wisconsin Institute for Healthy Aging. And I've been coordinating the Wisconsin Coalition for Social Connection. That role is now transitioning very shortly to Vicki Camp, and we're in the process of her taking over the coordination of the coalition. So you'll see a lot less of me and a little bit more of her in the future. But something that I do every day to connect. I'm a millennial. I still have Snapchat, but there are like 2 or 3 people that I Snapchat every single day. It's people that I don't necessarily see in person. They live a little bit farther away from me. So that's just a good thing that I do to connect throughout the day. So I'll just take a look here at the chat. So intentional connection and present moment with my kids. I love that, Karen. Walk with my dog. Try to intentionally make eye contact and smile when talking to people. Check in with each of my kids. Participate in webinars online or trainings. Oh, they're coming in fast and furious now. Check in with people on Zoom meetings. Call our friends and family. High five, make eye contact, smile, greet, offer assistance, make friendly comments with everyone I meet, say hi to people I pass in the street, do a mindfulness app with my daughter, talk with coworkers, check in with extended family. Seen lots of checking in with kids and family and friends. So I love that. Feel free to keep dropping those in the chat. So we do have a pretty busy agenda for the day. We are going to get started with our community impact speaker. And then we'll have Carly from the Wisconsin Department of Health Services briefly talk about some new data that we have available to us. And then we have Sydney, Alexis, and Gabby, who are going to talk a little bit about technology use and connection. We'll end with some coalition updates. And then you are all welcome to stay on for our optional networking from 3 to 3:30 p.m. So with that, I'm happy to welcome John. So John, I'd love to have you, introduce yourself. Lisa, feel free to jump in too, but tell us a little bit about yourself first before we get started.
Hey, hi, my name is John LaRose. I live here in Heartland. I moved here a couple of years ago from Texas. I had an illness that put me away for a little while, but I'm better now. I live in a beautiful little apartment right down the street. I don't know what else to say. What else should I say?
So I'm Lisa. I'm his daughter. I work at Health and Human Services in the Public Health Division. And I asked my dad to come here today. And we kind of thought maybe you guys could just ask him questions about how he socializes and things like that. He doesn't have a speech ready or anything. So we're just ready for you guys to ask him questions about how he socially connects. He is a natural extrovert. He does enjoy talking to people and connecting with people, but I'm always impressed about all the fun, different things that my dad does for himself. He doesn't really need anyone to help him, but part of his day is helping other people. So maybe I'll ask Dad a few questions. You guys can listen in, and if you have additional questions you want to ask him, he'll be available to answer. So Dad,
Yes.
you sometimes go to the different parks and lakes in the area, and
Oh, yeah.
and
All the time.
you take walks,
Yes.
and you
Every day.
I know you get to know some of the people at those parks,
I know.
and you sometimes ask your neighbors to go with you. How often do you go,
Uh-huh.
and why did you start doing that?
Well, I try to go every day to Negawaki. They got a
Mhm.
nice little place where you can walk from the beach all the way down to the boat landing, which is very nice. It's scenic, and I've met almost all the rangers who work there because I go there all the time. They
Okay.
know who I am. Emily is the head man, and Murph. I've gotten to know them, and they see me walking. They got a
Mm-hmm.
nickname for me because I use my walker when I
Okay.
go there. So they they call me Johnny Walker.
Okay. All right.
There's another guy I met there. His name is Bill, and he walks there every day too, also. And he wears this big hat, and they call him the Hat. So,
Okay. All right.
but I go there. I go to Pewaukee Boat Launch. I go to Lapham Peak quite often, and they have a beautiful path that walks for about a mile and a half. It's all paved, 8 feet wide, and it's even taken care of in the winter. You can go there. So,
Okay.
um,
What are some of the other things you do? Maybe some of the things at night. I know you play bingo.
oh yeah, well, where I live, every Monday night we have a lady, Rhonda. I live in an apartment with about 36 other people living there, and she makes us a real nice dinner every Monday night. Everybody's about half the people show up, not all the people show up,
Mm-hmm.
but that's kind of unique. And then on Wednesday night we have bingos for a quarter, unless
Mm-hmm.
it's the last. If it's the fifth Wednesday, then we play for $1.
Okay.
Um, I'm very close with a lot of my neighbors. I check in with them virtually every day, which is nice. I go for walks with Virginia, my really next door neighbor. There's a couple other veterans there that I
Mm-hmm.
deal with. And matter of fact, last night I went to my first Legion meeting here in Heartland, and so it was nice to meet all these new guys and we're kind of all in the same boat,
Mm-hmm.
but one thing is that we need more younger people to join. I mean, everybody there was an old fogey, just like me.
Okay. All right.
Uh,
Well, John, we have some questions from the group if you don't mind answering. So, what are your
sure.
conversation starters with people that you don't know?
Could you
What
say,
What are your conversation starters with people you don't know?
oh, usually I say, boy, another wonderful day in Wisconsin. And, and they smile at me because I try to enjoy every day. Uh, I went on this honor flight for the veterans to Washington, D.C. And on the back of the jacket they gave us, and on the shirts that we have, on the back it says "Every day is a bonus," and
Mm-hmm.
I kind of like that. Kind of,
Okay.
it's
He's an optimist, guys, if you can't tell already.
me? No,
I can
Okay.
definitely tell.
My daughter
Another,
has turned in, my daughter has turned into my mother. So,
Oh, well, I have to.
so,
there's another question asking if you still drive, John.
oh yes, I do, and I'll tell you what, I drive like a grandpa because I am a grandpa, and for years I drove with my grandchildren quite a lot. I really, all of us men think we're above average drivers. Well, when you get to be my age, you go to speed limits a little over, but you have to be aware of everything because I know I'm not as good a driver as I used to be. And but I drive quite a bit. I put on quite a
Mhm.
few miles. So
It's a big deal. He does take a lot of his neighbors to doctor appointments or the grocery store. He's often one that will offer a ride to people that
yeah,
aren't driving
okay.
anymore or who don't feel comfortable driving in certain weather. He'll take
That
them.
that happens virtually almost every week. So
Mm-hmm.
Well, we really appreciate
we're
having you here, John. I don't see any more questions, but would you just maybe want to wrap up by telling us, why it's so important to you to stay connected?
well. It's kind of a different situation for me. And I realized that in my whole life, up until a couple months before I moved from Texas to here, I had never lived alone before. I had high school, went to college, I was in the Army, I got married, was single for a number of years, found a beautiful second marriage, and she passed away, but she was a Marine. Uh, but when I moved up here, it's actually the first time I've ever lived alone. And The first time I've never had to get up every morning and have to go somewhere, to a job or things like that. Today is mine
Mm-hmm.
to do with what I will.
Mm-hmm.
It's great. So
How do you, I have a quick question for you, Dad.
sure.
How do you, I know you have some friends that are sort of hermits. They don't want to go anywhere.
Oh yeah,
They don't want to do anything.
no,
Do you feel that they're unhappy in that situation or they're content being alone? Because we kind of look at that at Health and Human Services as, people need connection. How do you feel and how do you try and help those people that aren't getting out?
well, well, you have to make it something that they think might be either fun or adventuresome or not so much adventuresome, but
Safe?
just different. I have one neighbor who he's an old vet, and I know he suffers from
PTSD.
PTSD, and I am trying to get him out, even to go to a meeting or something.
Mm-hmm.
It's very hard. He stays in his room so often, I got to go knock on his door and say, "Hey, what's going on?"
Mm-hmm.
So, but yeah, it's there are some people in my apartment that you just they just don't want to communicate with you, and I don't know how to get through to them. I try to be as nice as
Mm-hmm.
possible.
Mm-hmm. And you
Joke.
keep asking them, right?
Oh yeah.
He just doesn't stop. He keeps asking them. Maybe someday they'll say yes.
Maybe they don't like my jokes. I don't know.
Probably, probably.
One more question came in. Have you always been comfortable making friends, or is it a skill that was developed over time?
No, I've always gotten along.
Yeah.
I was the commander of the American Legion post down there in Arlington, Texas for a couple of years, and we had a big post, almost 400 members, about 100 active. Up here, there's only about 25 active, so
Mm-hmm.
it's a little different. But I've never had trouble making friends. I was the youngest out of five kids, so I was really. My sisters really taught me a lot when I was growing up. So
Mm-hmm.
Well,
He also, he's got an optimistic view where if you meet him and talk with him, you're his friend.
yeah,
He considers you a friend. You don't have to have a 5-year relationship to have a friend. So I think he considers a fast friend a friend, someone that you just met. So I think it's a positive way to look at things. You don't have to know everything about someone to be their friend, especially when you're that age. How do you tell someone about your whole life? But you can call someone a friend that you just meet.
yeah.
So,
And it's funny that where I live, a common thing between all of those people is they seem to all want to talk about what's wrong with them. You know,
oh yeah.
and I try and get away from that.
Mm,
I don't want to tell them that, geez, my knee hurts this morning. I couldn't get out of bed and things like that. So I try and be upbeat most of the time.
oh, well, maybe that's why people like talking to you.
Yeah.
mhm.
And trying to get the band back together again. Long John and the Donuts.
Yeah, if anyone's looking for a ukulele player, he knows 150 songs now, and they're pretty cool. So,
Well, I had a bad operation on my left arm and I can't use, I was a guitar player, but I can't use my hand like I used to. But I can play 3 or 4 chords on a ukulele.
mhm,
And I play every day for at least an hour.
mhm,
And I'll play and I sing and
mhm.
I've become a a ukulele virtuoso, not a virtuoso. Everybody, they see me coming with that ukulele and they go, "Oh no."
Well, I think
Yeah.
we can all
So,
probably listen to you talk all day, John, but there's one more question, and then unfortunately we do have to move on, but we appreciate you being here. What do you think is the biggest obstacle for retired individuals to make new friends?
the biggest obstacle. Uh, I don't know. I would. They have to be able to give of themselves. Whether they go to church or whether they go to different meetings. Some people are just, and I know there's a lot of loneliness out there, but thank God I'm not in the least bit lonely. I just the biggest thing I would think would be to they don't have a lot of feelings of self-worth like they used to. Like they're good for something. They worked and they provided and they helped, and now they're all on their own, and it's just hard. Sometimes it's hard for them to communicate. But and
getting over that fear of just that initial communication or what you say. Just
Yeah,
takes a little practice.
yeah, and you know some of my neighbors, and
Mm-hmm.
matter of fact, the house that you own, uh,
Fun fact, my dad's neighbor lived in the house I own for 50 years.
and
So we invite her over for Thanksgiving to have Thanksgiving dinner in the house that she grew up in. So it's
yeah,
kind of fun.
yeah, she's kind of a loner there, but
Yeah.
she's very involved with her church,
Yeah.
so
Yeah.
that's fine for her. So.
So I
She's a
see
good
a
lady.
couple thank yous in the chat. Appreciate your positive attitude and keep it up with and continue to share with those you meet. So thanks again.
Well,
Yeah.
I'll tell you, this is a great service that you guys have, and my daughter has signed me up for these computer classes that in September. I'm not really like a lot of us. We're not real smart on the computers and things like that. So,
Mhm. I don't know if you guys heard the ADRC is offering a computer technology class to people 65 plus in Waukesha County. And if you go every Tuesday for a 2 hour class, you get a free computer at the end of the class. So you can sign up through the ADRC in Waukesha County. I think they only have 20 spots available, and I don't think it's filled yet. So if you know someone that could benefit, have them email the ADRC in Waukesha County.
Yeah, we'll be hearing a little bit more about those sorts of programs later on today. Great. Well, thank you so much, John. Thank you, Lisa, for sharing. Feel free to stay on throughout the presentation. If there are any more questions, you can feel free to drop those in the chat as well. But I am going to stop sharing now and pass it over to Carly Malone, who is a research scientist and the BRFIS director at the Wisconsin Department of Health Services.
Thank you so much for having me today. I will start sharing my screen and we'll get going. I know I have too many slides for the amount of time I have, so I will probably try to gloss over some of the maybe boring data stuff. I won't be able to have great visibility into the chat while I'm presenting, so please just interrupt me, ask questions. Suzanne, if you see anything in the chat, feel free to just interrupt. Everyone see my slides all good? All right. So as Suzanne said, I'm Carly Malone. I'm the director of the Wisconsin Behavioral Risk Factor Surveillance System. And I'm here today to talk a little bit about what BRFIS is in general, just to give a little bit of background for those who probably aren't aware of it, but then to highlight a recent report that came out that was a collaboration between the Department of Health Services, myself, and Suzanne, and the team with the Coalition for Social Connection, specifically using BRFIS data to look at social and emotional support in disabled and older Wisconsinites. So I'll try to gloss maybe over some of the method stuff, but I want to at least give a little bit of an idea of what BRFIS is. And so you'll hear me call it BRFIS for the rest of this. It is the Behavioral Risk Factor Surveillance System, which is a big old mouthful. And what it is, it's a telephone survey that's conducted by state health departments in collaboration with the Centers for Disease Control, the CDC. It was established in 1984, and BRFIS collects data in all 50 states as well as the District of Columbia and 3 U.S. territories. And what that results in is every year we collect nationwide over 400,000 adult interviews each year, and that makes it the largest continuously conducted health survey system in the world. And so what we ask about and what we collect information on in BRFIS is a lot. BRFIS collects information on a ton of topics that are important both statewide and nationally. And that data allows us to look at disparities in health and healthcare trends in chronic diseases such as asthma, diabetes, cancer, social determinants of health, which includes social and emotional support and connection, as well as a variety of health risk behaviors such as alcohol use, alcohol, tobacco, and drug use. I'm going to skip over some of this, but basically the purpose of BRFIS is it allows us to get a pretty good picture about what's going on in Wisconsin and nationally. Just as at the highest level, this is a big old list. This is everything, every topic we are asking about this year in the 2026 survey. And so, as you can see, we cover a wide range of topics, including towards the end, you'll see some state added questions about belonging and meaning, as well as we have what's called the social determinants of health module, which also collects some information about social support, loneliness, and things like that. And we rotate questions on and off. Some modules are run every year, while others are run on every 2 to 3 year cycle. We try to keep our survey at about 30 minutes, but that can vary from year to year. And I don't want to get deep into survey sampling methods. That's definitely not this audience. But what I do want to make clear to everyone is that the way Burfus works is we have a random sample. In Wisconsin, we collect about 10,000 interviews a year. But because of the way we do our methods and we do what's called stratified random sampling, and we go through a statistical procedure called weighting, which is basically it allows us to produce reliable estimates for what's going on in the state overall from those 10,000 interviews. And it allows us to run statistics, produce estimates, and make interpretations about the health and well-being of Wisconsin. But what we're here to highlight today is the collaboration between the Wisconsin Coalition for Social Connection and our Wisconsin Burfus program. And together, we recently, earlier this year, released this report called Stronger Together, a look at social and emotional support for older adults and people with disabilities in Wisconsin. There was an earlier version of this report a few years back that was created in-house at DHS in our Bureau of Aging and Disability Resources. But the data capable staff in that bureau have moved on. And so Suzanne reached out to me and basically said, hey, we want to update this. How do we make this happen? So I was able to provide data and help support Suzanne in creating this report and wanted to just highlight a few things that we see when we look at our data. And so when we're talking about social and emotional support here in our visualizations, that is coming primarily from a question on the Burfus survey where we actually ask individuals how often do they get the social and emotional support that they need? And they give us an answer that's basically an always, usually, sometimes, rarely, or never. And so when we look at that data and we look at it for by age, as well as if we look at for our population of Wisconsinites who have at least one disability, what we see is basically regardless of age, adults with disabilities were more likely to lack the social support that they need compared to those without disabilities. We see some larger effects in the 18 to 64 age group, but still also sizable effects in that 65 plus. So regardless of the age, if someone has a disability, they're more likely to say, I'm not getting the support I need, the social and emotional support I need in my day-to-day life. When we start doing that breakdown and we start looking at it by different demographics, for adults with disabilities, those who were Black, Hispanic, low income, or indicated that they weren't married or had a partner were most likely to lack the social support they need compared to the overall population. And in adults who were 65 and older, we see pretty similar patterns. Those who were people of color, what we call POC, low income, or otherwise not married or partnered, these were the people who are most likely to indicate that they don't have the social and emotional support they need in their day-to-day life most of the time. Additionally, what we see is that there are connections and associations between those who lack social support and increased reports of mental health struggles and life satisfaction. And so when we're looking at here, the graph on the left, what we see for adults who said that they rarely or never got the social support they need, for those who are 18 to 64 with a disability, 62% of those individuals also reported that they had 14 or more poor mental health days in the past month. That's something we tend to categorize, we call that frequent mental distress. And that number, still holds pretty high for our sometimes and even our always or usual populations. Those with disabilities are more likely to report poor mental health, but it is especially true for those with disabilities who don't have the social support they need. And we also see patterns when we look at life satisfaction. We have a question on the survey that basically asks, how satisfied are they with their life? Do they feel like their life has meaning and purpose? Questions like that. And again, those who are disabled and don't have social support were much more likely to say that they were dissatisfied or very dissatisfied with their life. And so we see these strong associations between having emotional social support in day-to-day life, as well as indicators of life satisfaction, mental health, and things of that nature. And so I want to be respectful of time. I know we have a lot of other presenters. If you are someone who works with data or needs data, I wanted to just take a quick moment to let you know there are a variety of ways to get access to BRFIS data on this topic, as well as any of the other topics that I showed at the beginning in the summary. One of the easiest ways is you can reach out to me and we can talk about what your data needs are. And sometimes I can just create some data tables for you or give you some numbers if it's a small report or you're working on a grant application and needs some numbers to support, the need for this funding. But there's also a variety of online tools for those who are a little more data savvy. CDC on their CDC Breakfast webpage have a number of tools that you can use to look at prevalence and trend data across time in our state compared to other states, and for a variety of indicators. There's also a CDC project called CDC Places, local data for better health, and this allows you to look at a number of indicators at the county level in Wisconsin as well as for other states. And then finally, on our DHS website, we have a tool that's called the Wisconsin Interactive Statistics on Health. There is also some BRFIS indicators in there that are available. But overall, if you have any questions about the report, about BRFIS data and what BRFIS data can do to support you in the work you might do, or how to gain access with BRFIS data, please reach out to me. I said this is my email address, as well as we have a BRFIS email address, and I will make sure this information gets to Suzanne so that it can be shared in follow-up email as well. And if there is time, I am happy to take questions. I'm going to stop screen sharing so I could potentially see the chat.
Perfect. Just a question if the slides will be shared, and yes, they will be shared after the meeting with the recording.
I know I went pretty fast, but I wanted to make sure there was time for everyone else.
And I did drop the link to our website where the full report is. It's right there at the top, so you can always look at that, and we'll be sure to send that out with the recording as well. But if there are any questions, feel free to drop them in the chat. Unfortunately, we don't have time to answer those right now, but we'll either forward those to Carly, or if you have time to stick on for the optional networking after, we can always get to those questions then too. But thanks, Carly, for providing that overview of the BRFIS data and the report that we updated earlier this year.
Yeah, happy to be here.
All right.
Thanks for having me.
Yeah, thank you. Sydney, we're going to pass it over to you now and switch gears a little bit. So Sydney, feel free to go ahead and start sharing your screen. But Sydney is going to talk a little bit more about using social media to build connections.
All right. So I am Sydney. I did an intro slide because I didn't know how many people on here I would know. Um, so I'm a leader. I live in a rural area. I try to pick a fun photo because I do live in a rural area and it's kind of fun. I'm a person with disabilities. I am chair of BPDD board. I work for the ARC Wisconsin and People First Wisconsin. Um, So it's important to use tech to build connections. Some ways you can do that is with Facebook groups. I run a group called Wisconsin Disability Connections, and there's around 2,000 people in it. Um, and I'm also very active on LinkedIn. And that's one way that I build connections. With Facebook, it's more of like everyday people, and with LinkedIn, it's more of like workplace connections to help grow your network and learn from other people and see their articles. I'm also on Substack. Um, I have a link in another slide, but it's mainly for people who like to write and share on their writing. Um, I also build connections from going to Zoom meetings for work because sometimes when you meet with people often enough, you end up becoming friends with them. Um, there you go. So with Facebook, you can join groups and you can also create groups. Sometimes if you don't know a lot of people to start out with, you can just join groups. And once you build your connections, then you are more comfortable creating your own group and adding people. And like I talked about, I run the group Wisconsin Disability Connections. It was originally started and then I took over being admin and it kind of grew. Like some days I'll get like 50 or 60 join requests, and which is kind of crazy because people hear about it through word of mouth and want to join on Facebook. And people have really made a difference in people's lives just based on one Facebook group. And um, with LinkedIn, I think I got mine around 4 years ago, and I probably have 300 connections since then. It's really important for sharing stories because that's a big way that people can connect with you. And the reason why I joined LinkedIn is because around 4 years ago, I went to my first ARC National Convention and people wanted to connect with me, but I did not have a LinkedIn yet. And so they're like, well, how do I connect with you? And at that time, I didn't yet have a business card. Um, so those things came later. But it is really helpful. Say you're at a conference and you want to connect with somebody. You can find them on LinkedIn or they can just scan your QR code. And with Substack, it's really helpful to connect with others, whether you search for articles of people with disabilities or people with a hobby you really like. It's also really fun to write articles and then watch, you can see the data from how many people have read your articles. And you can also build relationships on Substack because a lot of times there's new people compared to who you know on Facebook or LinkedIn. And you can use tech to help with connections. Something that you can do is, I'm not sure if this group is familiar with like AI and the accessibility features with AI, because you can use it a lot for, like, say you are joining your very first Zoom meeting and you want some scripts for what to say, or you're going to a conference for the first time and you need icebreakers or conversation starters that can help. Or if you're struggling with a situation socially, you can ask for advice. I use it for everything from like voice dictation um, to helping me draft a better sounding email at work, or um, even like helping me break down a project into manageable steps. And that is it. I did it short because I didn't know how many questions folks would have.
Great. Thanks so much, Sydney, for sharing a little bit about how you use technology to build connections. I dropped some links to some of the things that you had talked about during your presentation in the chat, so everyone can feel free to take a look at that. But if there are any questions, can feel free to drop those in the chat. And then after Alexis and Gabby present, we will hopefully have some time for Q&A for Sydney, Alexis, and Gabby. So I am going to pass it now to Alexis and Gabby, who are with Sauk Prairie School, and they're going to talk a little bit about their technology program. So you guys can go ahead and take it away.
Yeah. Okay. So my name is Alexis Cleveland. I'm a rising junior here at Sauk Prairie High School. I currently am a part of many clubs and leadership activities. Outside of school, I dance, play tennis, and travel with my family. I have been teaching our Smart Connect class for 2 years, and I'm so excited to share what we've been working on.
Hi everyone, I'm Gabriella Bletch, and I'll also be a junior this year at Sauk Prairie High School, where I play soccer and tennis. I'm also involved in several clubs like FBLA, Student Council, and more. I also spend time working at a local restaurant, which I enjoy very much. And this past school year has been my first time teaching this class, and I've enjoyed every minute of it. If you guys have any questions, please feel free to leave them in the chat, and we will answer them when we get to them.
Yeah. Okay, so our Smart Connect class is held in 6-week sessions with one class a week. In the span of a school year, we host about 5 to 6 sessions. This class is free for participants, but we cap the class at 10 to 12. The students come directly to our high school during our study hall period. We believe this is a great way for the senior citizens to immerse themselves in the community, especially with the younger generation, to build those connections. And our curriculum teaches the basics of cell phone use, such as texting, calling, phone functions, setting alarms, emails, and more.
Our curriculum for Our curriculum, we use slides like these that we've customized ourselves, and it gives visuals to our students. And we found that these visuals help them, and they are similar to what they will be seeing on their screens, especially for more confusing topics. Arrows, circles, and text also help us explain things very clearly. All participants in our class receive a packet which contains every slide printed out. Students find it very helpful for up-close visuals as well as taking written notes. Students are also allowed to bring these home, and they can reference them when trying new things with their phones.
We also offer an advanced class that we recently added. We hold this class at the high school during our study hall period as well. We recommend those who are interested in our advanced class to first take the beginner class, as a significant amount of the curriculum builds off what is taught in the beginner class. Our curriculum dives into different ways to personalize the student's phone to better fit into their lifestyle, from wallpaper to medical ID. We also go over how to use all the helpful apps that our phones automatically provide that students are often nervous to mess with.
We have also started assisted living visits recently. So along with teaching a class at the high school, we've reached out to one of our local assisted living homes, and we're able to travel to them and teach our beginner class to them from the comfort of their own home. We went once a week after school and we taught our lesson and then answered some questions. And after that, a few times we were able to play games with them and make connections.
We've also held two 90-minute pop-up classes in our local community center this summer. These classes provided students with a brief summary of the basic uses of their phones as we teach in our beginner class. We've helped students troubleshoot individual problems that they've been having with their phones as well.
Some of the feedback that we have received. At the end of our sessions, we have students complete a survey to gain valuable feedback on our class. This helps us figure out what's working well and things that we may need to change to make our class more successful. Some positive feedback we have received is that we've communicated knowledge in a way that's easy to understand and that our class covered everything they want to know about their smartphone. All of our students have expressed that after taking our class, they are more confident using their own phone. And then here's also some of the feedback we received. I don't know.
We want this program to reach as many cities as possible. So if you are interested in starting this program in your county or your city, please reach out to us. We would be happy to help you out. As we work directly with the school, you will need to contact us through our academic and career planning coordinator, Mr. Pratt, and then his phone number and school email are below. Yeah. Thank you guys for this opportunity. If you have any questions, feel free to just shout them out and we'll be happy to answer them.
Thank you guys.
Thank you for sharing a little bit about your program in South Prairie Schools. We do have some time for Q&A. If anyone does have any questions, I think I saw one for Sydney in the chat. So if anyone has any questions, Carly had to drop off, but if anyone has questions for Sydney or Alexis or Gabby, feel free to put those in the chat. And Sydney, this question is for you. Is it okay to share the Facebook group link for the Wisconsin Disability Connections to those who may be interested in joining?
Yeah, that's totally okay.
Awesome.
The one thing is, I try to encourage people to answer the join questions because it makes my job easier when approving people because sometimes you don't want to let bad people in.
Yeah, definitely gotta have a little screening process. And then a question for you, Alexis and Gabby. How do you market your program?
So our marketing is all through the ADRC and our local community center. So the ADRC sends out monthly newsletters and our class is posted in that. And it's also on our community centers page. And they also post up flyers around our community.
Is it just you two that teach the class, or are there other students involved?
Yes, currently it's just us two.
Give it just a few more minutes here if there are any other questions. Or if anyone has similar, programs to share that they're doing, you're welcome to share that as well. Okay, I'm not seeing or hearing any questions. So again, if you do have any, feel free to drop those in the chat. But thank you all for presenting and sharing about your programs. You're welcome to stay on for the rest of the meeting. We do have the optional networking from 3 to 3:30. If anyone does have any additional questions, you can always, again, put them in the chat and we can get them to the speakers as well. Just wanted to share a few coalition updates before we wrap up. So we do have a new promotional video and it's just a little over a minute long. So I'm just going to play this.
The Wisconsin Coalition for Social Connection, coordinated by the Wisconsin Institute for Healthy Aging, is building a diverse network of people and communities across Wisconsin to live healthier and more socially connected lives. Social connection can significantly lower the risk of many health conditions, such as dementia, heart disease, and anxiety. It can also help us build healthy habits and even get better sleep. When communities create more chances to connect, it builds trust, reduces loneliness, and helps neighbors look out for one another. You have the power to make a difference. Reach out to a friend, family member, neighbor, or coworker and make a meaningful effort to connect. Together, we can strengthen the relationships that build healthier and more supportive communities. Interested in getting involved? Join the Wisconsin Coalition for Social Connection.
So that video is now available on our website. I think it's under the For Professionals Awareness Resources section. But you're welcome to use that on your own, social media pages or just to share more information about the coalition with others. I think we did a save the date recently, but another save the date for our Social Connection Awareness Week, in case you missed it. We lead Wisconsin's Social Connection Awareness Week every year, and that is going to be held November 8th through the 14th of this year. We'll have additional information as it becomes available on our For Professionals events page. But we do have our theme picked out for the year, and we'll be focusing on everyday connection, lasting impact. So stay tuned for more information that'll be coming out for Social Connection Awareness Week in the next couple of months. And while we're on the topic of awareness weeks or months, September is Falls Prevention Awareness Month. So our theme for September's Falls Prevention Awareness Month is Stay Steady, Stay Connected. So we have a lot of resources related to older adult fall prevention and social connection available on our Falls Free Wisconsin website, and that's linked on the slide. So if your work kind of goes into that realm as well, you're welcome to use those resources. We have a press release, newsletter article, radio talking points, social media graphics, bus ads that can be, used and customized. We're holding a media contest, so the organization that gets, a certain amount of points can be entered to win a prize. We have a community webinar that I think the date for that is September 24th, and that one is all about social connection and fall prevention. So definitely check out our promotional resources page for Falls Prevention Awareness Month and use and utilize any of those resources as well. This is just an example of our social media graphics. So we have, the graphic and the text all there so that you can just plug and play those. And then here is the information for our community webinar. We'll have Debbie with Curative Therapy Services presenting September 24th from 11 a.m. to 12 p.m. And this is open to anyone throughout Wisconsin to attend. The registration is open. You can consider holding a watch party for the event as well for that day. So with that, if there's no other questions, we do have just a couple of minutes, so we'll stay on. But if you found this or other Wisconsin Coalition for Social Connection network meetings or resources helpful, we'd greatly appreciate a small donation to help us keep this important work going. You can scan the QR code on the screen or click the Give button on our website or in our next newsletter. And as a reminder, we'll continue the meeting for as long as anyone wants to stay on until around 3:30 for some optional networking and discussion. But if you need to jump off, we totally understand, but feel free to stay on, introduce yourself, introduce what you're doing, or just, kind of digest and talk about what we learned about today during the meeting for a little while. I'd also like to thank Melina Cares and TMG for sponsoring the Wisconsin Coalition for Social Connection. Our next network meeting will be on October 20th, and the recording for this meeting will be sent out sometime within the next week or so. And after you close out of Zoom, you'll be automatically redirected to a survey. So please complete that survey. We have a new question on there this month asking about what sort of resources would be helpful for us to develop for you all. So that's really important for us to get that feedback. So we really appreciate it. So with that, thanks to everyone. Thanks to our speakers for the day. And again, definitely feel free to stay on for our optional networking.